Hello and welcome to The Big Picture. I'm Tina Jha. A group of 14 countries has expressed shared concerns over a new report by the World Health Organization into the origin of the COVID-19 outbreak in China. These countries, which include the United States, the UK, Japan, Australia and Canada, besides some other countries, have cited delays and a lack of full access to data and samples, as well as a lack of cooperation and transparency from China, calling for an independent analysis and evaluation of the pandemic, which is free from interference and undue influence. Although these countries did not directly reject the report, they said they remain committed to working with the World Health Organization. Now, the report of the team of the WHO experts, which visited the Chinese city of Wuhan, where the virus was first reported in December 2019, was published on Tuesday, and these concerns by the countries came following the release of this report. As per this report, it is extremely unlikely that the virus escaped from a laboratory in China. Instead, it suggests that the deadly virus jumped from bats to other animals and then to humans. On this edition of The Big Picture, we will talk about the key findings of the much anticipated WHO report and the concerns raised by countries over this report. Joining me on the program are two distinguished panelists. Let me first introduce them to you. I have with me on the program Dr. Rakesh Agrawal, Director, Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry, and former Ambassador S.R. Tayal. Welcome, gentlemen, on this edition of The Big Picture. Dr. Agrawal, let me begin the program today with your response to the WHO report that in a way concludes that the novel coronavirus emerged first in bats before spreading to humans through what they call an intermediate animal. And they say there is no evidence yet to identify the species where the spillover of the virus from animals first occurred in humans.
So I would go by what the report says. Basically, the evidence comes from looking at the genetic sequence of the viruses isolated from humans and those known from viruses isolated from other sources. For instance, what has been found is that viruses that were the cases that first occurred in China, the viruses isolated from them have been sequenced. They had sequences which were very close to each other. So it appears that the virus had not been circulating in humans for a long time, and it has been estimated that that was only for a few months. So it seems that virus first reached the humans somewhere in the last few months of 2019. The viruses that have been isolated from other species, the human viruses, are very similar to those coming from bats. So it appears that the origin of the virus was from the bats. However, humans don't very closely come in contact with bats, not that they cannot come in contact. So it seems that and these viruses do cross species barriers. So it appears that it could have gone into another animal which comes more commonly in contact with bats. It could be a wild animal, it could be a domesticated animal, or it could be pets. And once they got it, from there it jumped into humans. This is entirely plausible. This is how viruses jump. This is how we know about Ebola that is going around in Africa, that it comes from primates to humans. And similar things have happened with HIV in the past. Absolute certainty is never possible. HIV has been with us for now nearly 40 years. Do we know absolutely how it came to humans? No, we don't. That would never be possible. So that's where we are. This is entirely correct. And the sequences that we have in humans, there is no evidence to show that those are lab manufactured sequences. So I think we have reasonable evidence that the method that has been proposed by WHO is plausible. Also, the names of people who were on the committee, some of them are real world authorities, and one would have faith in what they say.
But obviously, how it infected the first human is something that remains unanswered. That's the big question. And that's where multiple concerns, Ambassador, have been raised by a group of 14 countries over the methods that were used to gather physical evidence from China. There are concerns by these countries that the report has been compiled without having full access to complete data and samples from Wuhan. So taking these factors into account, how credible is this report according to you?
On this WHO report of experts, 14 countries which have very advanced scientific establishment, medical establishment, research establishment, have expressed their concern publicly on the findings of this study, saying that it has been delayed and it lacked access to complete and original data and samples. So the report is based on incomplete data and incomplete access. If we go to the Chinese track record since January of 2020, when the first such virus report started emerging, we know how the whistleblower Dr. Li Wenliang of China was hounded, was persecuted, was silenced, and eventually he died of coronavirus. We know how China influenced, pressurized WHO not to issue a warning. And China, the biggest perfidy was that it banned the movement of people from Wuhan to other cities of China, but did not ban travel from China to other countries. So China's track record, China is a closed society. China is a very controlled society. There is no freedom of information of any kind. In China, it's a suppressed society. And this study, in that a Chinese co-leader was there. A co-leader was Chinese, Liang Wanmian, Dr. Liang Wanmian. And this entire, the WHO team was not allowed entry till January of 2021.
Yes.
Now, so much of delay has been there. There has been no access to any kind of data. So what could this team has done? A good job, as the doctor is saying, with whatever data was available. It is not a question of just science. It is a question of evidence. And when you are investigating a supposed crime and the perpetrator of that crime is a co-leader of the team, it is very difficult for anybody to have any trust in the findings of the team. Here, I have some experience of working with UN organizations, and unfortunately, the way the UN organizations, even WHO, even experts sometimes work, it becomes a very diluted kind of a report, and it does not come to conclusions because people have to come to some agreement and some consensus, and in which the actual facts get buried. So there is no credibility on this report because there was no data. And even after much malign, the Director General of WHO has himself questioned this report. And he has said that the assessment is not extensive enough. Laboratory leak requires further investigation. And he has said that WHO is ready to send more experts and teams wherever investigation is to be done. So it is an incomplete report based on incomplete data, and world can have no conviction or no faith in this report.
But with the kind of delay that has already happened and the kind of lack of transparency by China, these are two factors. So to expect or whether the world will actually know the origin of the virus, that's something that only time will tell. But Dr. Agrawal, coming back to you, because what the ambassador says makes a lot of sense. The country where the virus actually originated did not allow the WHO team to visit until January this year. And for a country that took nearly 2 months to actually inform the WHO about the emergence of such a disease in its country, obviously transparency is the last thing that the world can expect. Is it possible, although the WHO report says it is extremely unlikely that there was a laboratory leakage, but is it possible that after so much of time has been lost, the traces of origin of such a virus can actually be erased from labs?
See, things are, till one really goes there, one doesn't know what we are talking about. But the viruses jumping from animals to humans is very well known. That is how it always happens. That's how it very frequently happens. We have Ebola virus going around parts of Africa. There have been several instances of jumping of Ebola viruses occurring. So we have had in the last few years this happening several times. There are times when we have used this ability of viruses to jump species to our advantage. the smallpox vaccine that helped us eradicate the disease from the face of this world was actually a virus related to human smallpox called cowpox virus, which was in cows, and that would get transmitted from cows to humans. And it was noticed that when that happens, human disease cannot happen, and that is how we developed vaccine. So it also happens that the vaccine strains sometimes become active. So that is what is happening with polio. We have the polio live vaccines, and sometimes they change slightly and cause disease in some people. So these variations, these are all entirely biologically plausible. Mm-hmm. What happened in a particular case can never be 100% proven, but reasonable evidence. This kind of things happen in nature, and this is plausible. That's all I can say. So with that, biologically speaking, there is no problem in saying that viruses could have come from bats, either directly to humans or through another animal species. I can only talk from what biology knows, what science knows. What
Absolutely.
diplomacy, what countries do, I can't comment on that. That's not my area of expertise. I can comment only on science.
Absolutely. So, Dr. Agrawal, so when the WHO chief says that he himself is ready for further investigation into the theory of the outbreak of the pandemic, and this, of course, although there is no evidence of the intermediary animal, but in all probability, it jumped from bats to humans. Will we ever succeed? Because it's been more than a year that the virus actually originated in Wuhan. That's what the world believes. Will we ever succeed after so long in knowing where and how the virus originated? Will traces be still available if the WHO team is actually allowed access to full data and all samples?
Even if you have access to all data, what would you have? Specimen of the first person where the disease was suspected. Before that, there would have been some other people who would have been infected, who could have been asymptomatic. We know that a large number of infections with this virus are asymptomatic. There could have been people before that who were asymptomatic. We will never know that. Even if you have every human being on earth available to you, the virus doesn't persist in them. The virus disappears after a few days, as we very well know. Even a layperson today knows. It is just not possible to go there. Secondly, there is HIV. A similar hypothesis exists for HIV, that HIV was a virus that was circulating among monkeys in Africa, and then it jumped into humans. Even today, despite knowing that happened in early 80s, there have been occasional specimens where blood samples that have been stored from before 1980s have had viruses very similar to HIV. Whether it jumped at that time, also, it's possible that it jumped into a person at that time, but did not spread further. So again, these are things for which 100% proof can never be done. We can never prove this. We can have reasonable certainty, at least in biology. That's how biology is.
Okay, Ambassador, so there are two factors that the countries worldwide are citing. First, of course, the delay and lack of transparency by China. Even if the WHO persists on further investigation to come to a robust conclusion as to where and how the virus originated, what are the kind of investigations that would be required, and what is the level of transparency, again, we can expect from China?
One thing on the science part, of course, Professor is right. The Chinese do eat bat soup. So it is possible that from bats it could directly come to humans or through some intermediary animal. Yes, possible. But I would say that whether China has made the complete research record of the Wuhan virus laboratory available to WHO, and I am absolutely confident that they have not done it, because all the reports were that they had cleaned up that laboratory and they had perhaps demolished that laboratory. But whenever some experiments are done, there is extensive data kept, and of every experiment, every specimen, every virus, there would be some kind of a record and some kind of a data. But I am very, very doubtful whether China has made any of that available to the WHO team. And that will be one factor which needs to be very clearly told by this WHO team, that the original data of that Wuhan laboratory, which is generally believed, and it was certainly going through all kinds of experimentations because even the Americans were funding some experimentation there. So the laboratory in Wuhan is a fact. The virus originated from Wuhan is a fact. And any, like Sherlock Holmes will say, you have to see why the dog barked or did not bark. Here, I would make one comment. President Donald Trump was absolutely right in accusing China for originating this virus and spreading it all over the world. He made that mistake that he walked out of WHO so that the influence of United States in ensuring a fair, impartial, and clear inquiry was diluted, and WHO became even more financially dependent on China. So WHO was just not in a position to demand anything from China because you cannot ask your paymaster that you please behave. So there have been mistakes done by the international community. Now, again, the entire emphasis should be what exactly was happening in that laboratory, Wuhan laboratory. Where is its data? If they destroyed it, why did they destroy it? And if they destroyed it, it is clear that the Chinese are culpable. Chinese are hiding something. And Chinese are responsible for inflicting this pandemic on the world and harming its economy. Here, of course, I will say, of course, it is very unscientific, but the general public of India and the world is asking, the entire world is suffering from this pandemic, and the Chinese, where it originated, it is incontrovertible fact that it originated in Wuhan. The first epidemic spread in Wuhan. Yes. But China, nothing is happening. China is merrily safe. So was it some special kind of a virus which they were able to engineer? It is an unscientific question, but evidence, it's a question in the common man's mind. It is a question in my mind. I'm a chemistry student, but it is a question in my mind. How come all the other countries of the world are suffering? India is suffering, everybody is suffering, and China, they are totally controlled it. So again, there are so many questions which need to be answered scientifically and with evidence. But unfortunately, all the evidence is under the control of China. And I'm sorry to say, China under Xi Jinping is not going to disclose that.
Dr. Agrawal, so even though it looks like it may have transmitted from bats to humans, the world is still not ready to put an end to the theory of a lab leak. So if I would, want to understand from you, is there a WHO protocol for laboratories worldwide that these laboratories, especially if we talk about BSL 3 and 4 labs, to check incidents of bioterrorism, such leakages of virus, and if there are any rules, are they stringent enough?
See, we can have conspiracy theories. They are very easy to make. There are many other countries in the world where the disease is not as active. Singapore, Taiwan, Thailand, which is not a very rich country. They are Hong Kong, okay, we can leave it out. But these are countries where there is not much of disease because they are able to control their public health in a very different way than many other countries do. So Taiwan has been open. Singapore has been open. Thailand, of all countries, has been really free of disease. So there are multiple ways. Now, there are rules in place, but a whole lot of it is self-regulation. WHO is an advisory body. WHO doesn't get into each lab and see. For that matter, they can't come into our labs, each lab, and see what is happening. They cannot. This is each country's own duty. Okay. But labs keep their own records. Lab keep their own. They have their own procedures, protocols. Now, if somebody decides not to show some part of the lab, for instance, I could have 10 notebooks and I could keep one notebook away and only bring in notebooks of 9 of my accounts. That's perfectly fine. Then that is something. So I don't see that WHO can ever have a role looking at each lab very closely. That can never happen. That's just not possible. WHO neither has the resources nor has the mandate. WHO ultimately works through country governments. Ultimately, it's each country's government that decides what they have to do. They are a recommendatory body for everything. Even when they recommend a vaccine, they recommend it, but the policy decision ultimately is taken by the country.
Okay, so Ambassador, clearly it's self-regulation that's work. So to ensure that such outbreaks do not recur, because the current one we've seen, it wreaked havoc worldwide, what should be done? Is there need for more stringent rules for laboratories, especially for those that are dealing with biological samples? Should the WHO step away from just being an advisory body? Should it be strengthened further to at least take decisions on such matters?
Countries have to be honest and transparent and share information. If we really see how the disease spread, China tried to control information, it did not share information, and it pressurized WHO in non issuing global warnings that it is a pandemic. So it has the lessons have to be learned at multiple levels. One, of course, as you are saying, of course, biological warfare, etc., has been banned. Now there are conventions against biological and chemical warfare. So no country should indulge in any kind of experimentation on viruses, but experiments are done to find remedies, to find antidotes, to find control measures. So this will happen. But what kind of protocol should be there so that there is no leakage of any kind of virus, or in future? I think the scientists have to tighten that entire system and protocol. And the World Health Organization, public health bodies, they should keep politics aside and the ego of the country aside, and very quickly share information amongst their own citizens and with the international agencies, so that remedial measures can be taken, because the countries are very advanced, public health systems are advanced. It cannot be like a Spanish plague or something that millions died and there was no remedy, no solution, no control. Every country has solutions, but the the key is it has to be triggered very much in the beginning of once a pandemic spreads. So very clear identification without suppression of facts, as China did by harassing, persecuting, and silencing that unfortunate Dr. Li Wenliang. He was called by the party office and asked to shut up and not share those. China is culpable. China should be punished for that. China should be fined for that, because it is their system. And unfortunately, there is no accountability. And China will get away with it because other countries are weak, they are not united. And this is unfortunate fact which the countries together have to think about. But ultimately, some kind of a monitoring protocol over all the laboratories where such experiments are done on viruses and other biological agents, and a system of total transparency by all the countries, that if anything suspicious happens, if any new disease is recurring, which is not known, which is unknown to the doctors and to the experts, then there should be very quick sharing of data, of biological data, medical data, clinical data, so that immediately antidotes can be found. And in case it is a contagious disease, if it is a disease which can spread with the infection, then the remedial measures can be advised, not only in that country, but globally, because collectively, I believe that the international system has a lot of expertise, it has a lot of knowledge, it has a lot of experience. And if it is shared, then any new pandemic, any new disease, any new virus can be controlled in the beginning itself. But again, it depends on the countries concerned that very quickly they identify that there is something new happening.
Yes.
And don't conceal that data, share that data with all the experts which are internationally available. And it would not have taken such a shape which it has taken, unfortunately, this Chinese virus, which China has inflicted on the world.
Okay, Dr. Agrawal, coming to you with the final question. So the ambassador has spoken about three things: cooperation, transparency, and accountability. So for the larger good of mankind, how can we foster cooperation and trust between the investigators and also between and within countries?
What the country does will have to vary by the different infections. For each infection, there would have to be strategy. We, of course, need to spend more on our healthcare and health systems. That goes without saying. But I can say one thing as a person in science. This pandemic is an epitome of what can be done by international cooperation, and there has been excellent international cooperation. The fact that we have so many vaccines is because very early, within a few days, in January 2020, we had the sequence of the virus published. If that had not been done by a Chinese lab, we would not have had vaccines so early. We have seen cooperation across countries. So a British lab, Oxford, makes a vaccine. They sign up with so many companies with Serum Institute in India, with a company in Belgium, with a company in South Korea and Brazil to make vaccine in different places and distribute it. A COVAX facility is set up, which will distribute vaccine free to 92 countries which cannot afford it. Trials of vaccine developed in one country have been done in multiple countries. Again, with variants, we are seeing that international cooperation. And I think one thing, the kind of international cooperation across all continents that has been seen in science is the reason that we had vaccines injected into people 1 year, even when 1 year had not elapsed from the discovery of the disease. And I don't think we can do something better than this.
Certainly.
And as a country, we need to invest more in health.
Certainly. So it's this cooperation that has helped us not only during this pandemic, but I'm sure this kind of trust and cooperation worldwide will also be the key to managing future pandemics as well. And as both our panelists said, of course, it's the need of the hour that for a country with a huge population, we need to invest more and more in our healthcare system. So with that, I'll have to call it a wrap on this edition of The Big Picture. Thank you to both my guests once again for joining us on the program today and sharing your perspective with us on this subject. Pleasure having you on the show. So that's it from us on the program today. Just in case you missed the television broadcast, you can also watch it on YouTube and Twitter, and you can get back to us with your feedback and suggestions. Thank you for your time.